So why are we seeing this? We're continuing to look at this a little bit more closely each and every day, getting more into the details so that we can better understand. And even with time, we know that there is not going to be just one answer about why this is occurring here in Rhode Island and nationally. There are a number of factors that are likely in play. One of these factors could be the makeup of our critical workforce. We've talked about our healthcare workers a lot as key members of our critical workforce. There are also people in many other fields who are out there working every day. That includes people who are not licensed healthcare providers, but who also do work in hospitals and other healthcare facilities, helping to sustain the work that gets done in those facilities. And it also includes people who work in food processing plants and in other elements of the food industry, as well as in warehouses and in manufacturing facilities. These people are going to work every day because we need them. We depend on them. As a society, we are learning a lot of lessons from this pandemic. My hope is that one we will all learn and remember is the criticality of the work of the people who are going in every day in Rhode Island. While being out and continuing to work every day could be putting some people at greater risk, there are more long-standing structural issues that may also be affecting the rates of illnesses that we are seeing higher in certain communities compared to in others. We know that 80% of our health outcomes are determined by factors at the community level. Most of those factors occur outside of the medical setting or the examination room that I can say as a physician. 80% of what makes people healthy happens outside of what actually happens in the examination room. I often refer to these factors as socioeconomic and environmental determinants of health. They include things like the stability of our housing and whether or not someone earns a living wage. I've spoken previously about other living conditions that someone is subject to within the environment that they're in. These factors impact someone's health and can make them more vulnerable to something like COVID-19. And given the strength that they demonstrate, the courage and the bravery that they demonstrate, they are also more resilient in the face of things like COVID-19. And of course, these factors also have a tremendous impact on people in moments at a time like this when people are already trying to make ends meet and are getting squeezed even more.